How much time did you spend entering data about your COVID patients or about patients in general? We are a group of doctors that got tired of entering data in the EHR system and not getting anything in return. So what we have here is an application of AI, linguistic AI, that basically transforms clinical notes or clinical reports into a big database that we can then analyze.
Just about everyone will get a respiratory illness at some point over the course of their lives. Breathe is helping to facilitate access to data sources across the UK to allow people to better understand respiratory disease. Electronic healthcare record data is fundamental to helping us answer some questions around respiratory disease and particularly around drug effectiveness. The UK has some of the richest sources of routine electronic healthcare record data, which when de-identified are available for researchers. However, some of that data is quite difficult to get to, and this is where our partnership with Savana is so important.
In the first place, privacy. Not only because it's of course compliant with all the regulations and it has been approved by countless ethical committees around Europe and America, but also because it goes beyond the standards with something that we call natural privacy, which is basically also an application of AI into privacy, which makes things very complicated for anyone who wants to try to re-identify the information, making it virtually impossible. Secondly, because it's multilingual. So by joining this ecosystem of research, it's not only English-speaking sites that will be able to join and publish together, but also French, German, Spanish, Portuguese-speaking countries can contribute. And in the third place, because it's not only about transforming the information from the text into variables, it's about the meaning that it has from the clinical perspective. It's what we call the deep real-world evidence, something that we've been specializing for during 7 years.
Our partnership with Savana is incredibly exciting because it unleashes the ability to access really detailed information in the secondary care electronic healthcare record that we've so far not been able to access at scale to be able to answer really specific questions. The Big COVIData study is incredibly exciting because it allows us to use new technology around natural language processing to read and gather information from de-identified clinic letters and free text that's available in secondary care medical records to let us answer questions about COVID that we've so far not been able to answer. My role in the Big COVIData study has so far been to pull together the hospitals across the UK who are interested in taking part of the study and helping to sort out the protocol and the ethics submission around the application. Once the data have been collected and we're able to analyse the data, we will be able to format it into a structured data set and put it in our trusted research environment in SAIL to allow researchers to access the data going forward to answer their own research questions.
By using this technology, this platform, Dr. Izquierdo was able to publish this article in the European Respiratory Journal about the intersection between asthma and COVID, not previously reported, and he was able to do it getting the information almost in real time. Besides this, Big COVIData, only in the first stage, it has already 3 more publications. So this is what we can offer all the researchers that are now joining in the UK, the possibility to expand the amount of evidence that can be generated with the same effort of entering the data during the clinical practice.
What's great about the technology is that we don't just have to limit it to investigating COVID. And going forward, I'm hopeful that we'll continue to partner with Savana to be able to use the technology to explore other respiratory diseases.